Hi, how are
I'm gonna go to
you?
the clinic a bit later. So I just showered and my hair is like dangling wet, but it's not hitting my scrubs, which is a good thing. Thank you so much for being with me here today.
No, thank you
Such
for
an
having
honor.
me.
Thank you
I was
so
really
much. So
excited.
if you could first please introduce yourself to everybody. Thank you.
Yeah, so my name is Dr. Playforth. I'm a board certified pediatrician and a mom of three. My
Wow.
youngest is 4 months old, so I'm like right in the
Wow.
thick of it. I write at the Pediatrician Mom for exactly the reason that you just
Mm-hmm.
said. It's
Yeah.
not just with COVID, but like with everything. There's so much information. And I think as a parent, it's really hard to figure out like what is
Yeah.
good
Yeah.
information, what is
Yeah.
misinformation, what is dangerous information.
Appreciate all of the posts that you make here on Instagram. So I did have pediatrics clinical rotation that way way long ago, and I was like, this is such a complicated subject matter. So we needed to go from the infants up to what 21 years old or 18 years old, and I just
Yep.
remember dreading
Mhm.
the exams because I'm like, oh my gosh, I have to know all of this, the developmental stages and what they can't eat or what they can eat a certain month. Props to the pediatricians and those in pediatrics. And you have a lot to learn from me today. And as someone who is a nurse but went back to school for my post-bac studies to pursue medical school, the past year that I've been back in school, I think it just hit me that, oh my gosh, what did I enter myself into? This is such a long road. My mom is a nurse of 30 years. So I'm like, wow, this nursing is a terminal degree, and then I guess I'm a sadist and I decide to go in for more. And that is what you went through and all physicians have gone through is years of schooling and
Mhm.
training, so much sacrifice that had to be done for sure. I wanted to know what's the root of all of that. What were your inspirations to actually pursue this long and arduous field? Was it like a family member, a friend, or a personal experience?
Yeah, so it was a family
Hmm.
member. So I grew up in Malawi,
Yeah,
which is a small
yeah.
landlocked country in
Hmm.
sub-Saharan Africa. Most people don't know it.
Wow.
And I was there till I was
Hmm.
18 and then came to the US for college.
Okay.
But my dad was a physician there,
Hmm.
and he's been the inspiration for this. He worked
Hmm.
so hard
Hmm.
and he was a family physician. So he saw kids, he saw grown-ups in a
Hmm.
setting where they're really a pretty resource poor setting.
Wow.
He's now in the US as well, but he was the inspiration for pursuing medical
That's
school
really
and
that's
then
amazing.
pediatrics ultimately.
One of my classmates in my postbac program, she's been an engineer for years, and she was like, "No, you must be crazy to do a postbac." Well, I was like, I think so too. To actually enter this such a long road, definitely it's delayed gratification, right? But you've already reached
Yeah.
that point. You've been practicing for years now. You've gone through all the schooling and training. And like I said, for sure, so many sacrifices that had to be done. Time, money spent, and all of that. Missed celebration, missed this and that. At the end of it all, do you have any regrets for pursuing this long and arduous road?
I think it probably,
Mm.
my answer now is different than my
Yeah,
answer
yeah.
would have been, a few years ago for sure. I definitely remember a moment in residency where I was just in tears and I was like, why am I doing this? Like,
Hmm.
this is just not worth it. Because all of our friends
Hmm.
that were in their
Yeah.
20s were out, having a life,
Yeah.
traveling, earning money.
Hmm.
Residency is
Not
not a
at all.
well compensated experience. And, you're doing 80-hour weeks with 4 days off in a month. So there were definitely moments where I regretted it. Since then, I mean, since I've done pediatrics, I actually feel much better about it because, yes, there are hard things about pediatrics, but it's also so rewarding
Hmm.
and connecting with families,
Hmm.
connecting with
Yeah,
kids, getting to like get
yeah,
down on the floor and play with them and see the
yeah,
smiles, not with masks,
yeah.
but, generally to connect with them is
For sure,
is
for
so
sure.
rewarding.
Yeah, that's very funny because I have interviewed a few residents and then a lot of attendings now, and there really seems to be that discrepancy in answers. Each resident that I ask, "Oh, is it worth it?" It's like, ask me in a few years.
Yeah.
Few attendings that I'm talking, like, yes, it's worth it. There's no regrets. So that is a testament again to the whole delayed gratification part, but still such a rewarding road for sure. And if there's someone watching who's either a pre-med student or a med student, what would be your number one advice
Mhm.
for that person?
I would probably say
Mm-hmm.
be sure that you want to do this
Mm-hmm.
because, like you said, it's such a big commitment.
Mm-hmm.
It is so much of your young life and so much of your time
Mm-hmm.
that if you're not in it, really in
Yeah.
it, you will regret it. The experience of
Mm-hmm.
residency is
Yeah.
physically taxing as well as mentally taxing. And, I think most attendings look back and think
Mm-hmm.
it was a rough few
Yeah.
years, but actually that how taxing it
Mm-hmm.
was part of like how
Mm-hmm.
you learned how
Mm-hmm.
to handle like a variety of different situations. And so it's almost necessary. I mean, there are parts of it that are not, but you want to make
Yeah.
sure that you're really in it and that you have a support
Mm-hmm.
system. My husband is not in medicine, and I was incredibly lucky that he told me actually just a few weeks ago when I would come home. So if I were working at night and I'd come home in the morning and sleep, right? That I would come home at the end of the day and there would be this trail of clothes between like the door
Yeah.
and the bed, and then you would just be sleeping. I have no
So
memory of
funny.
any
Oh
of
my God.
this. I was like, really? And he was like,
Wow.
yeah, I did all the laundry. I picked it all up,
Yeah.
but
Yeah.
I didn't even
Yeah,
like
for
know.
sure. I think it's really all about why you want to do it, right? This is something that our previous physician guests have talked about is what do you think is or are the right reasons, if there are, for a person to go into medicine? I think we've heard it all, like, oh, it's a good paying job in the end. Oh, there's some prestige imbued in it. What do you think is the reason for someone to go into this such long road with so much sacrifices?
I think that it's probably the same
Mm-hmm.
reason that is the case for really any career,
Mm-hmm.
which is that you
Mm-hmm.
love
Mm-hmm.
it, that you are interested in the material, right? Because, I mean, yes, the prestige is there, although I'll tell
Mm-hmm.
you with pediatrics, that's not so much the
Mm-hmm.
case. Even compensation in pediatrics is not, great at all.
Mm-hmm.
But if you love the subject
Mm-hmm.
matter and you are excited and stimulated by the subject matter, then the other stuff, there are so many different pathways you can
Mm-hmm.
take. But if you are
Mm-hmm.
interested in what you are doing and
Mm-hmm.
engaged with it, then it won't
Definitely.
feel like
I
work
super agree with
that
that. And I
much.
super agree with the whole compensation part for pediatrics. I recently found out about it not too long ago. And me and my postbac classmates are like, wait, what? Really? For the spectrum of
Yeah.
age that you're basically taking care of everybody. And it was just mind blowing to me. But so that's a topic that we can get on later. But pediatrics, we've had pediatrics ICU doctors here. We have pediatric allergies, and we have
I saw
pediatrics,
both
the
those
one that ties it
interviews.
all together. I know you told me that your father was a physician in family medicine who's seen all ages, but
hmm
why pediatrics? For sure, you've seen some adults. You weren't into geriatrics, or was there something during, I don't know, clinical rotations?
Yeah. Yep. And I
Yeah,
saw your interview
yeah.
with Dr. Patel, and she kind of said the same thing that, you go in with this idea of, I actually went in
Mm.
thinking I wanted to do psychiatry. I had done in
Oh.
college, I worked in a baby lab. We did experiments on babies, which sounds way more sinister than it really
Yeah.
is. It was kind of like, psychological experiments, but
Mhm.
like looking at like what they know and what they understand and stuff. And I thought, okay, so I
Mhm.
like psychology. I'm going to
Mhm.
like psychiatry, and that's what I'm going to do. And then I did my
Mhm.
rotations, and psychiatry, I liked it fine. But then I went into pediatrics, and it was just so, what's amazing about children? When they're
Mhm.
sick, they act sick, but the moment they
Mhm.
feel better,
Mhm.
they bounce right back. They don't sit around feeling sorry for themselves. They're
Yeah,
wanting to
yeah,
get better. And I
definitely.
think that's not always the case for grown-ups.
Mhm.
There's a lot more kind of sitting
Mhm.
around feeling sorry for yourself. And,
Mhm.
and that resilience was just so inspirational that once I did pediatrics, it was no
Definitely
looking
agree with
back.
the clinical rotations. The kids were always so excited to feel better. I've been working cardiac surgery step down, so
Yep.
very heavy surgery, but you set
Oh,
expectations that, oh, by
yeah.
this day you really have to get up. And but there's that feeling from the patients of, no, I can't do it. Let me wallow in my pain first. And
Mhm.
definitely it's so different in
Yes.
children. I remember my clinical rotations, I had a child who was sick with normal virus, and it's like, I just want to get better. I'll do anything. I'll take any medication you give me. And that enthusiasm is so different. Something that you can't see in adults. Adults will be like, why do I have to take this? So yeah,
Yes.
yeah,
Yeah. Or,
I'll
oh,
be
I
here
don't feel better
later, stuff like
yet.
that. So I
hmm
see where that fulfillment coming from the field of pediatrics. And can you please enlighten us? What is the road to pediatrics? Like, is it its own specialty?
Yes, it
Yeah,
is. So, I
yeah.
mean, this is obviously very US based. Actually, I was thinking about what you just said about compensation and respect for pediatrics. And in other countries,
Oh.
pediatricians are seen as specialists and actually quite well
Mm-hmm.
respected. The looking down on pediatrics is
Mm-hmm.
a little bit more true here in the US, but
Mm,
so you do medical school, which is your 4 years, right?
mm-hmm,
And then after that, you apply for residency. A
mm-hmm,
general pediatrics residency is going to be 3 years. And then if you want to do a
mm-hmm,
subspecialty, so,
mm.
Dr. Patel is a pediatric intensive care. And then I know
Allergist,
that you had
yeah.
Dr. Ralan, who's the pediatric allergist. So at that
Mm-hmm,
point, you apply and you do your subspecialty. If you want to do general pediatrics, you decide whether you
mm-hmm,
want to work in a
mm-hmm,
hospital setting or outpatient or both. And then you kind of start that. You apply for jobs. I think that there's a lot of flexibility in pediatrics too. I started off working full
mm,
time, and then I had my
yeah,
kids, and I decided I wanted
for
a little
sure.
bit more
Yeah,
flexibility and time to spend with them. And so pediatrics
definitely.
is
Got it.
friendly to
Got it.
part
That's amazing.
time.
Through all of that, like you've just listed out 4 years of medical school, 3 years of residency, what has been the most, probably a lot, but what has been the most memorable experience so far, like at the top of your head, whether it's the scariest thing that you've gone through or the most fulfilling so far, which is probably a myriad of things.
There is a lot of, it's
Mm-hmm,
really
mm-hmm,
satisfying to
mm,
do procedures.
mm,
And you don't get to do as much in general pediatrics, but I remember, every procedure I got to do as a resident
mm-hmm,
was so
mm-hmm,
satisfying, but also so scary. There's an adage in medicine
mm-hmm,
generally, that's see one, do one, teach one,
mm-hmm,
right? And
mm-hmm,
that's part of what
mm-hmm,
residency is. You are just thrown in the deep end,
yeah,
and someone will show you how to do, for example, a spinal tap. They'll show
yeah,
you one, and then they'll be like, "Yeah, go do the spinal tap." And
yeah,
as a parent now, thinking
yeah,
about it, that is alarming.
yeah,
But
mm-hmm,
it's okay, and there is supervision, and
mm-hmm,
and that's how you really learn. Because there's
yeah,
sometimes you really need to be kind of
yeah,
pushed to see where
yeah,
you can end up, push your potential.
yeah,
So I think those experiences,
yeah,
having to run a code without having done that before, it's just
yeah,
very
definitely,
scary,
yeah,
but also you learn so
yeah,
much.
you learn the most in the fire, which is, I believe, is so true. I
Yeah.
mean, just seeing residents in the hospital, so since I'm in a teaching hospital, seeing residents like run around and fly around,
Yeah.
it's like, oh my gosh, I feel so bad. And then the next second, I'm like, oh wait, this is gonna be me too. So I was like, oh my gosh, this is
Not too
horrible.
long.
Let me be nice. Let me be nice to this resident. But that being said, still, what do you think is the greatest challenge that you've gone through? I don't know if there would be one single thing that where you just almost broke down all throughout this journey before practicing on your own.
I had one patient that I
Mm.
remember very vividly, and it was partly because the patient was somebody that I saw and was taking
Oh
care of my
my
very first. It was like
gosh.
July
Yeah.
1st of my 3rd year.
Hmm.
So it was the first time I was a senior resident, and it was a Sunday.
Yeah. Yeah.
And so,
For
the
sure.
hospital was a little bit
For sure. Yeah.
understaffed to begin with. And, in pediatrics, we don't get very many codes. And the patient was on the floor, and then we got called. And I had never really run a code before, but just having to do that from start to finish. And thankfully, the attending that I was working
Ooh.
with, he was
Yeah.
on his way out the door, but he hadn't left yet. But that day, we
Hmm.
spent all day with this patient, and we managed to get them back. And then he was leaving, and he
Hmm.
told me, so the patient was
Hmm.
on a
Hmm.
special type of
Yeah.
ventilator called an oscillator, which kind of vibrates. And he told me to do a spinal tap. He was like, okay, so do a spinal tap on this patient. And I was thinking, how on earth do
Yeah.
you do that with a patient that's like moving? And it was just, I didn't know how to do it, but I did it, and it went fine. And that
Yeah.
experience gave me so much confidence that, no
Yeah.
matter what, there is a way to figure things out. I had
Hmm.
a wonderful team of
Hmm.
nurses that were there and supporting me, and just understanding that, like,
Yeah.
it,
Yeah.
it's
Yeah.
not just the
Yeah.
doctor. The whole team is so
Yeah.
important, and we all have really different roles to play, but nobody can
Yeah.
succeed unless everybody else is helping them out. I think that's the most important realization of pediatrics.
On July 1st too. Oh my goodness. Yeah, every July 1st, and you see the interns come in, and I'm just like, oh my gosh, here we go, here we go. And you just try your best to really support the residents as well. It's also a phase in the whole hospital system as a whole is sometimes there's animosity between certain professions and disciplines.
Yes.
And
Mhm.
really, at the end of the day, it's all about the patient and like all hands on deck, all teamwork. Yeah, definitely. Oh my gosh, I just can't imagine being a resident. Do a spinal tap, do this. Oh my goodness. Yeah, I had a 2 hour code, I think 2 months ago. We had to reopen a patient's chest at the bedside post surgery because I found him in like VFib. So,
Oh.
and my ID was flipped. So the head surgeon thought I was a resident. And I was like, okay, go, help me suction the chest cavity. And I was like, whoa, 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 wait, wait. Let me pull up my ID. Let me show you. Let me show you. But yeah, definitely you learn the most in the fire. And I think part of that fire also is the amount of emotions involved in this field. And I specifically want to link it to pediatrics, and Dr. Raylan is watching. Hi, Dr. Raylan.
Hi, Dr.
We
Mill.
have children who have a whole life ahead of them. Sometimes you see like the prognosis of elderly patients is like, we give them as much comfort as much as we can, let them enjoy the remaining years of their life.
Mhm.
But for children, this is different because they have their whole life ahead of them. And you envision children who will turn into youth, who will turn into young adults, who will turn into adults, and
Mhm.
hopefully live their life. But there's kids who get sick and really, really sick.
Yeah.
How, as a pediatrician, as the head of the care of these sick children, how 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 I think that's my main question is how do you manage all of that?
So I think it's become
Yeah.
a lot harder since I became a parent
Mm-hmm.
myself
Yeah.
to have a little bit of
Mm-hmm.
distance, because
Mm-hmm.
to make objective
Yeah.
decisions, you have to have a little bit of
Mm-hmm.
distance from
Mm-hmm.
the situation. And if you are
Mm-hmm.
envisioning, I mean, your
Mm-hmm.
empathy and your
Mm-hmm.
compassion is higher, I think, as a parent, but then
Mm-hmm.
it's harder to make objective decisions, because then you're
Yeah.
like, what if
Yeah.
this were my child? How would I feel in this situation? I think it is hard, but
Mm-hmm.
we are so lucky in this country to
Mm-hmm.
have the resources that we
Mm-hmm.
do. Even when children get sick, a lot of
Mm-hmm.
times we have
Mm-hmm.
great medical
Mm-hmm.
care, great
Mm-hmm.
options, vaccine preventable illnesses now, where
Yeah.
the outcomes are still good,
Mm-hmm.
and we have access to those resources. Thinking
Mm-hmm.
about somebody like, I mean, I grew up in Africa, right, in sub-Saharan Africa. The resources, you have somebody with malaria, you have somebody with tuberculosis, HIV, children with those diseases, they don't have very many options. It is tragic when a child is sick here, but it is also
Mm-hmm.
something that we can manage. And I think as a pediatrician, what you need to sort of do is be the
Mm-hmm.
support, not just for the child, but for the parent, and to kind of help them navigate the system. Because I think what's hard
Yeah.
about the US is that there's so many specialists, and
Yeah.
everybody's like, oh, kind of punting the problem a little bit. And the pediatrician needs to help bring everybody together, because, like you
Yeah.
said, ultimately
Yeah.
the patient is the important.
Yeah. I think that's one of the things during my rotation that I was like, oh, I don't know if I want this field because I feel like generally, even in adults, I feel like it's the family members who sometimes become more of the patient than the actual person in the bed. And but I feel like it's
Mhm.
such a different topic
Yeah.
when it's a child because these are parents that you're dealing with. And I feel like some parents,
Yep.
if not all, probably not all, but they come in under your care with already a predisposition of what they think is best for their child.
Hmm.
Mix that. How do you mix your expertise and mastery in this field and present it to parents who have their own idea of what is best for their children?
I think you have to come from a place of compassion.
Mm-hmm.
Every parent wants what's best for their child. And so, if a
Mm-hmm.
parent has an opinion about, what
Mm-hmm.
that is something you need to
Mm-hmm.
respect. Now, it may not be the right choice. And part of what I love about general pediatrics is I get to
Mm-hmm.
know the families over
Mm-hmm.
years. I get to know first siblings, second siblings, third siblings,
Mm-hmm.
and I know kind of what the family dynamic is. I know
Mm-hmm.
what kinds of things a parent might be anxious about. I'm an anxious parent myself, so I get that. I think that everybody needs to feel like their doctor is on their side, and in that it's not an
Mm-hmm.
antagonistic thing. It's like a marriage. You have to find
Yeah.
like some compromise that leaves everybody better off. I also think that if you have a good relationship with a parent, then they should be willing
Yeah.
to listen to you too. It's a two-way street, and that's part of the benefit of being an
Mm-hmm.
outpatient pediatrician.
That place of understanding. Now, how do you mix that with things like vaccines, specifically, let's say the COVID-19 vaccine, where there's so much discrepancy in opinions and information about it. I can only imagine parents coming to you who have their own views about not only just the COVID itself, but the vaccines as well.
Yeah.
And, we've learned about ethics and stuff of historical events, maybe within the recent years, where children have died at the face of parents not wanting medical care because it's against their religion or their culture or whatnot.
Yeah.
Now, where does that place of understanding come into play when it comes to things that are preventable but are actually when the parents' decisions and beliefs are harming their children's health?
I have a reputation for telling it to people straight. I think that sometimes when you talk about it as if it were your child, so for example, with the COVID vaccine, I have a 6-year-old daughter. People are worried about fertility in girls. People are worried about long-term effects. I get that. Those thoughts have crossed my mind too. The thing is, the decision that I make for my own child should be the same decision I'm recommending to other people, right? And whether that's to do with, a treatment option or a vaccine preventable illness. And I think people often are willing to hear it if they know that as a parent, you are making the same choices. There are times when you have to really have sort of a come to Jesus kind of conversation with people. I've thankfully only had to do that a handful of times, but those times are very hard for parents and for pediatricians. And sometimes what it means is that you're not necessarily the right provider for that parent, but you need to have a balance of trust in order to provide advice. And if they aren't able to trust you on a lot of basic things, then maybe that isn't the most therapeutic alliance, because I think that they're not going to be happy. I'm not going to be happy because I don't feel like we're doing necessarily the right thing for the child. And I think the other thing is that there's a lot of nuance in parenting, and certain things like how do you introduce solids, for example? Should you do baby-led weaning? Should you do purees? There's actually a lot of right answers, and it's only where the evidence really shows that there is a single path that is important.
How hard is it for you though has there been a time where a parent was just like, no, and then let's say you just have to let go? Do you?
I've had to do that a few times, and they were it was really hard. I cried a lot. I don't think the parents knew how upset I was about it, because then you kind of feel like I took it personally, right? I thought it was a failure on my part for not communicating something correctly. It was when I was a younger physician. I think I've come some ways in recognizing that sometimes people just do not see eye to eye, but it was very hard the few times that's happened. No pediatrician ever wants to call Child Protective Services, for example, but sometimes you have to.
Instances of child abuse or this or that, or parents who willingly do not want any type of care for their children. I just can't imagine, as the head of the care, how must that feel. But I feel like being a pediatrician, right, there's so much authority in your role, which is why there's no better person to ask questions to regarding pediatrics, but pediatricians, right? And I talked about this with Dr. Patel as well, when she wrote an article, because there was an article that was released about pediatrics, but it was all adult doctors who contributed to it. And
I remember
like,
it.
why don't you let the pediatricians talk about pediatrics? And so, as the expert of the field, once and for all, as someone who has a 6-year-old daughter who the vaccines are open for now, do you feel like it is safe for these children to get these vaccines that has so much controversy about it?
I mean, I do. My daughter got her first vaccine on Saturday. I was so excited. She was less excited, but we did it, and I was thrilled that we had the option. I mean, I've spent a lot of time looking at the data. What the FDA was looking at. I talked to a bunch of doctors, immunologists, infectious disease specialists. Been doing research, and I think if you really look at the data, you would pick the vaccine.
It's really about the data. There is a rabbit hole on TikTok and Instagram. There's so much opinions going on from those who do not look at the data. And scary to say, but there are some where it's coming from actual medical providers as well. But again, very, very few people, but the general consensus is that the data shows that these vaccines are safe, and it is such reassurance for it to come from a pediatrician. So I have been vaccinating children against COVID-19 since it opened last week, I believe. There were really parents who were crying when
Yeah.
their children were getting the vaccine, and there were kids who were crying, yes, some because of the fear of the needles, but there are some who's like, oh, I've been waiting for this because of my friend who has cancer and can't get it or stuff like this. And it just shows you like sometimes how much more mature children can be compared to certain adults. And it's such exciting times. It is such exciting times.
Yep.
Definitely scary. Yeah.
I think, yeah, it's scary, but I think children sometimes cut through all of the fluff, right? Sometimes they can see the heart of the matter.
Just a comparison. I have had adults who is already sitting before me. I have already taken out the vaccine and ready to administer it, and they'll whisper in my ear and they'll be like, "Oh, can you pretend to give me the vaccine?" And we'll pay you. And I was like, whoa, 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 whoa. You could get arrested for this. Like, you don't have any of that with children. Children are just like, oh, my friend got it. I'll get it too. And I think that also roots from the parents themselves, right? And that roots from the education that they have received from their pediatricians, from their children's pediatrician. So really, thank you for all of you do and for all the education that you do. And because I know it's not easy. It's not easy at all because, especially in the face of social media, where there's so many trolls, so many trolls, and so many haters on here.
It's sort of crazy what people will say. I put out a post about my decision for my kid, just to how I thought through it, because I thought a lot of parents maybe wanted to see like how does a pediatrician who's a parent think through this decision, and I got some awful messages.
Oh my gosh. I can only imagine. And that's actually something what I wanted to ask you is, how has the pandemic changed your practice? Definitely like physical practice for sure changed. We've closed and lockdowns here and there, a lot of virtual stuff. But how has the pandemic, in the light of being on social media, changed who you are as a physician? Because I'm so sure you were not unchanged after all of this.
Well, the pandemic, I wasn't on Instagram before the pandemic. And then when the pandemic started and there was so much confusing information out there, I wrote a couple articles that were well received. And I realized, there's a need here. Now, the desire to put the Pediatrician Mom as a resource together, I've wanted to do for years. And I just kept putting it off, like waiting for the right time. And eventually my sister, who's actually a pediatrician, told me as the pandemic started, you just need to jump in. You just need to start. And I second guessed myself, but I was like, you know what? She's right. Probably my younger sister's right. And I just did it. And the learning curve has been pretty steep on how to use Instagram and how to put together graphics and make a website and all this stuff. But the pandemic has been a lot of people don't have the option of, going out with other moms or having support and connection, especially when they've just had a baby. As somebody who was pregnant through the pandemic, that the options of a community that I had with my first two pregnancies, I didn't have through this one because I was so worried, even if I was vaccinated. So I think that the pandemic offered an opportunity to educate parents because a lot more parents were turning to media, and then also just to provide support. You're not the only one feeling these feelings, and it's okay to be feeling these feelings and fears.
Is as vaccines were rolling out, it's the return to in-person education, and I think that was a big headline as well. Is it really safe to return back to in-person education for these kids? Is masking enough? I mean, we've heard of states where they don't even mandate the masks. As a pediatrician, did you think it was safe for kids to return back to school, given all of the safety measures that we have available?
So back in the spring, I didn't. And we had the option of having our daughter return to some version of in-person school. She's a kindergartner, and virtual kindergarten is, special. But at that point, I was pregnant and she couldn't get vaccinated. And I was like, there's still so much that's unknown about this virus that I just don't feel comfortable. So we actually kept her home. Then, as we learned more, I had the baby. We were still being quite careful because a young baby is still vulnerable, right? But as we learned more and as more people got vaccinated and as the rates were sort of starting to kind of move downwards, I definitely thought it is worth it. Also just looking at what the rates of mental health, mental illness, isolation, all of those things were skyrocketing in the pediatric population. And it's all risks and benefits. So she is in in-person school. They mask all day. She's fine with it. Her attitude about it, I think a child's attitude about a lot of things is predetermined by the way a parent frames it. And if you frame it as, kind of matter of fact, like, we've got to get a vaccine or we've just got to wear a mask. This is just what you do. Like the kids kind of roll with it better than we do as grown-ups. And so she's been in in-person school. We're lucky that our school tests them every other week for COVID. And so, we haven't had any cases, knock on wood, and everyone's just careful. Like we all have sort of a community attitude about it. And so people aren't taking risks. And she told me, the majority of her class is already vaccinated. This first grade.
Making much more measures than most adults, right?
Yeah. We are so lucky to be in the community we are.
Sure. Talking about mental health, I think the topic of mental health and mental illness has been such a great topic, but also a taboo topic in pediatrics. I think kids going through depression, pediatric suicide, and all those things.
Yes.
Which I'm sure you see a lot of the whole psychosocial aspect of these children and their dynamics with their parents. And so we did have submitted questions from my followers. Almost all of them really dealt with the whole mental health aspect in children. And one of the questions is the idea of the home. I feel like we see different phases of the home now, right? Conservatively, we have seen a mother and a father, and now we've seen same gender families and homes. There's always been single parent homes. As someone who sees for sure all of this in all of these different categories and different phases of the homes, do you think there is a set home, or does the general idea of the home contribute to a child's development? Do we see more, I don't know, if the word trauma or lack of development is seen in single parent kids as opposed to kids with a mother and a father or a complete set of parents?
I think it all depends on how stable the home is and how much kind of love and connection there is there. The idea of adverse childhood kind of events and how those, even in young infancy, will impact your psychosocial development down the line and like your own ability to connect and have a family. Like we know that data exists, but I don't think that there is a set family that is ideal. It's all about how involved your parents are and how safe children feel mentally, physically. There are obviously socioeconomic factors that play here too. And as much as we can do to make sure that there's stability, whether it's a single parent home, a same-sex parent home, it doesn't, I don't think that matters as much as making sure that we are providing resources so that parents' mental health is good, so that they can then make sure that their children's mental health is as stable as possible. The other, so kind of flip side of that is also making sure that there's good access to medical care and mental health care, which in this country, the access to mental health, what I've seen this year, the past few years actually, is that even when pediatric patients need, psychotherapy, psychiatry, there just aren't very many providers that are accessible. And then even when there are, insurance doesn't cover it. And not everybody has the resources to pay for that out of pocket. And that's where I think the problem is. If we can provide good, rounded mental health care as well as stable homes in the form of maternal, leave and it's just kind of taking care of the family as a whole, I think that will then translate into children being healthier.
So if there's no set of home, what do you think? Is there a perfect or ideal recipe to what drives the development or of a child or for them to thrive, especially in the early years? You think is there a set like concoction of factors that must be well meshed together for that to work out.
I get a lot of questions about this, kind of in the flavor of what kind of developmental stimulation do I need to give my 2-month-old, my 3-month-old, you know? And I actually like to have parents kind of take a step back. The fact that you're asking that question already means that you're providing something that's intrinsically important. The fact that you are paying attention to that is enough. To answer your question kind of more specifically, I think the answer is stability and love, and the social stimulation. A lot of parents are worried that if their kids are around, like in daycare, around masked providers, or if their kids are at home and not going out into the world and having stimulation with other kids, that somehow their kids are going to be sort of affected by that negatively. And I think kids are a lot more resilient than we give them credit for. Ultimately, if they have good stimulation and just normal level social interaction from their family members, that probably goes much further than we give it credit for. You don't need to be paying out of pocket for expensive lessons and things like that. I mean, if you can do all of that, my gym and things like that, that's great. But I don't think that those are crucial as much as just having a child, just talking to your child and having them connect with you, making eye contact, reading to them. Like, what they need is much simpler than we think.
Beautifully said. And as you were talking about like social interaction, the right level of social interaction, I think what's big nowadays is the social interaction through the phone, through social media, technology. We have seen the highest rise in technology the past few years, and we're seeing kids of the youngest ages scrolling through their phones the whole day. I know.
They know how to swipe, even really early. How do they know that?
I was talking with a friend the other day. She's a pediatric nurse, and I told her, I said, honestly, isn't it scary how some kids are so advanced with their fine motor skills now because of technology? Like, you see kids with iPads, right? Like straight out of the womb, already going like this.
2-year-olds.
Do you think that has a adverse consequence to a child's development early on if they're so easily and early introduced to technology? Let's say a 6-year-old, or 6-year-old, do you allow them to be like on the phones or use the phones or iPads or, I don't know, be on social media like in the next few years?
I think there's, like everything else, there's balance to it. Anything in excess is probably not healthy, including avoiding avoiding screens. It's probably not healthy because then you sort of put it on this pedestal. It's kind of like dessert. You put it on this pedestal and they're like doing everything they can to get to it. And at some point they will be exposed, right? So part of our role is to allow exposure, but in a frame that is safe, but is allowing them to make some choices. So in our house, we are very intentional about screens, and we've been that way from the beginning. So under the age of 2, it probably is worth avoiding. But beyond that, and I will say, with every subsequent kid, we've kind of chilled out a little bit more about it.
For sure.
But we're just very intentional. Like, we will say we are watching this specific show for this predetermined length of time. Like, we're going to watch 2 episodes of it, and then we try and talk to them about it. Like, I don't typically let them just like sit and watch and zombify. And I find that with certain shows, they're so like intently zombified by the show that like they almost have this like they're coming off of a high afterwards, and their behavior is worse. And so we avoid the shows that are really overstimulating in that way. There are certain shows that I personally really like Bluey, which we've discovered recently. Honestly, there's like a whole subtext level that's great for parents in that show. And the episodes are just 6 to 8 minutes.
Very
so like
quick.
You can do, okay, we're going to do 2 minutes of 2 episodes of Bluey, but we're just intentional about it and very specific. And we lay out ahead of time, like when we're going to end. So the expectations are there. Now, I'm not saying, I mean, my kids still throw tantrums sometimes when we have to turn it off, but if we are thoughtful about it, then I think that helps them be thoughtful too. And the other part of this is also, what are we doing as parents? Since I've created the Pediatrician Mom, I spent a lot more time on my phone, and my 6-year-old made an observation about it a few months back. I dropped my phone and it broke, and I was like really bummed out about it. And she was like, well, is there a silver lining? And I was like, there's no silver lining to my phone. And she said, well, maybe now, Mommy, you can talk to me more. And it was so jarring to me to hear her say that,
Mm-hmm.
and because it's so astute as an observation, that I have become
Yeah.
more intentional about just putting my phone
Yeah.
away with
Yeah.
notifications
Yeah.
off, like in the evenings,
Yeah. Yeah.
because I don't want her to
For
be
sure.
thinking
Wow, that
that.
that is amazing. And I think that's
It
something
was
that
jarring,
certain parents miss too, is that they're always like, "Oh, don't do this, don't do this, don't do this." But the children, it's like lead by
but I'm
example
doing it.
again, right? Like as the resident,
Yeah.
you see, you do, and
Hmm.
you copy what's going on. And yeah, and I think that the technology question, the social media question, was rooting from the general public's fear about cyberbullying and seeing violent
Hmm.
things on the internet. So I think there's some level of understanding for that fear, but I agree that everything's a balance. And
And you've got to be
yeah,
careful about it, right? Because kids are savvy and they
yeah,
can figure out social
yeah,
media and in
yeah,
the internet better than I think we can. So I mean,
yeah,
there's a show on Netflix right now called
yeah,
Squid Games, right? That I mean, I think everybody is talking about. I
yeah.
have not watched it, but I watched like a preview of it, and I was talking to somebody who says that their kindergartner has been watching it, which
I watched
like
it, so I'm
what?
like, oh no, oh no.
Like we have to
Yeah.
be vetting that stuff. Like that is not when a
Mm-hmm.
child doesn't have any
Mm-hmm.
understanding of like what is realistic, like they
Definitely,
should
super
not be
agree.
watching
But
things
I
like
also,
that.
what I think I like about certain technological aspects now is the amount of protective layer that these developers put on these apps or in
Hmm.
the phone itself. You can put like a timeout
Yeah.
um, period on the phone. I think for Netflix, there's a family account where it bars certain shows or certain
Hmm.
ratings from being watched. Even YouTube, I know there's YouTube Kids or some, yeah, so
Yeah. Good
um,
YouTube Kids.
so
Yep.
yeah, definitely it's also something that the parents and the companions need to be aware as well. Oh my gosh, Squid Game. Oh no, no, no. I watched the whole, yeah,
Yeah, like
yeah,
those
yeah, yeah,
safety nets are
definitely.
there, but you can't rely on them because you still need to be like participating actively
Yeah,
because kids are
yeah.
just
Oh
smart.
my
They're
gosh, they
just
are.
so clever about this. And, you know,
Yeah.
I when I heard that story about the kindergartner, I actually, I was reading that a lot of like first grade, like a lot
Yeah.
of young kids are like playing these games like at recess and stuff. So I actually asked my daughter about it, like, has
Yeah,
anyone
yeah, yeah,
mentioned
yeah,
this
yeah.
game? Like, I didn't want to tell her anything about like what it was. And she said no,
Oh
which
yeah,
was a
for
relief,
sure,
but like
for
you've got to
sure.
keep
And I
checking
feel like
in.
also word like spreads fast with the children nowadays. See, I mean, even when I was a kid, like, oh really, oh really, and it spreads across the whole room. Older siblings that tell them,
Or they
yeah,
have
for
older
sure.
siblings that tell
And
them.
wow,
Yeah.
I've been learning so much. And I think one question that I wanted to ask you, Doc, is what is the biggest myth you have read or seen so far about the field of pediatrics? And how do you counter that myth? Or the myth that, I don't know, that probably annoys you the most because it's something recycled so often from people who have no background and no authority at all to speak about pediatrics. Yeah,
That is exactly what annoys
yeah,
me. That
yeah.
sometimes there are people with no background that make claims. I think the article
Mm-hmm,
that we talked about
mm-hmm,
earlier is a pretty good example. There is a common misconception that children's
mm-hmm,
physiology, anatomy,
mm-hmm,
pathology
mm-hmm.
is the same
Yeah,
as
yeah.
adults. They're just
Mm-hmm,
basically small adults, and children are
mm-hmm,
not. They're
mm-hmm,
fundamentally different the
mm-hmm,
way they think,
mm-hmm,
the
mm-hmm,
way they operate, the way their bodies operate, and I think people who think that children are small
mm-hmm,
adults really minimize
mm-hmm,
the
mm-hmm.
level
Yeah.
of expertise that a pediatrician brings. What we're trained to do, and you alluded to this earlier,
Mm-hmm.
like the physiology of like a young baby, like my 4 month old
Yeah.
is different than the physiology of a 6 year
Yeah.
old, is different than the physiology of a
Yeah.
teenager, and we need to know all of it because like you can go from
Yeah.
a 4 month
Yeah.
old's room
Yeah.
to a
Yeah.
teenager's room and then back, right?
Mm-hmm.
We
Yeah.
are the experts
Yeah.
at this, and we've chosen to study it, and people should be looking to us for the guidance. Now I think a lot
Mm-hmm.
of pediatricians aren't stepping up and
Mm-hmm.
talking about it,
Yeah.
which is part of the issue.
Last thing is I want to go back to what we said about in other countries, pediatricians are very well respected and probably well compensated as well, but not here in the United States. Do you have an idea of why that is? What is the difference here in the United States that we don't have that level of respect for pediatricians relative to other countries?
I think part of it is I worry sometimes that in this country, we don't always prioritize pediatric health as much as we should. Like we're focused so much on other things that pediatric and then maternal health are both sort of an afterthought. And that is evident politically, that is evident in like the way certain policies are put together, but also there is more respect for procedure-based specialties as well. People that are doing surgeries or endoscopy, like procedures just get better compensation. And so then people are more attracted to those things than they are to, basic outpatient primary care. Because I've had so many specialists say, well, pediatrics is just like coughs, colds, and ear infections, right? But no, it isn't. Like you are impacting the whole next generation. It's huge. But until that culturally changes in this country, I worry that things are not going to improve.
Well, I've learned so much today, Doc. But, besides being a physician and a mother and a content creator and author, you are so much more than that. And that is the question I want to ask you is outside of all of this medical jungle, and I can only imagine how busy it has been since the pandemic started, especially for your field and the parents, and the whole vaccination series came out. How do you decompress out of work? How is life outside of a physician?
I got really into yoga through the pandemic. I try to carve out time for that. I have to say, with 3 children, with the youngest being so little, like sometimes I just don't, and that's not healthy, because then when I find that I am not decompressing, then I find that I'm more easily frustrated by the kids, by the family, by situations. But yoga has been a big source of comfort for me. And then I have a Peloton, so I enjoy those rides a lot. And then also some of their non-ride content is fantastic. And then I enjoy cooking. Not baking, but like cooking meals, finding recipes. I'm a vegetarian, and sometimes finding recipes that actually right now I'm not just a vegetarian, I'm dairy free because my baby has a milk protein intolerance. And that has been a really interesting challenge, trying to find recipes that my vegetarian and dairy heavy in their diet children will eat that I can still eat without having to make multiple meals. So I spend time on those things.
I love it.
And then just playing board games with my kids. I love playing board games with my kids.
Play with them too, right?
Yeah. They're old enough now where like you can sit down and actually play a game with them and talk to them.
Thank you so much. And hopefully one day we can come back and reconvene. And I really want to touch more about that vegetarian aspect and how it works in a pediatric home. I've been more plant-based the past year, and I'm slowly trying to edge my way into the whole vegetarian sphere. And I'm very curious to see, hopefully in another live, how that translates to children, because I think there's also a lot of talks about a purely vegan, a purely vegetarian diet in kids. All talk about protein and stuff like that. Yeah, and maybe we can.
There's a lot of myths about it. Yep, it can't be done, or they won't grow, or actually, Dr. Raylan is also plant-based, and that's part of when we worked on this book, this 10141. Like, there was an emphasis on plant-based options for babies. So that would be a really fun conversation to have. It's interesting.
Raylan can actually get on a 3-person live.
Yes.
And, we can. Yeah, and I really want to also promote 10141 as well, because I truly, truly love it. Well, Dr. Playforth, thank you so much.
Thank you.
With your time and your presence and your wisdom today. I am more and more encouraged in this long path of probably crying tears for the first few.
You're going to be fine.
And I hope you have a good day. And Dr. Playforth, thank you so much. Have a great rest of the day. Bye. Of course. Bye.
Thanks so much.